The dimensions of this debate are two competing arguments presented on either side. One side believes that this app is a means for state surveillance rather than a tool for fighting COVID-19. These voices argue that the privacy of citizens is at stake through the Aarogya Setu app. They feel that the app violates certain legal principles. They say that this app will open the door for large-scale monitoring of citizens by the state. They feel that a private sector alternative based on consent may be a better solution to fight the pandemic rather than putting too much power in the hands of the government. The other side believes that the Aarogya Setu app is one such measure for disease prevention taken by the government of India, as has been done by various countries through contact tracing and social interaction mapping. They see immense potential in this app, which has gained a user base of 70 million over a short span of time. And they argue for the expansion of digital health services such as triage and telemedicine, like Mr. Kumar pointed out, through this application. They see the Aarogya Setu app as a tool in the hands of doctors and frontline workers for strategic and timely medical intervention and a means for potentially alleviating the stress on the public healthcare system and avoiding further spread of disease. It's important to address both these concerns. It's important, given the magnitude of the lives, economic costs, and public health data at stake, to justify what other viable alternatives exist today, which will allow nations and public healthcare systems to fight this virus and protect their citizens. The dimensions of the debate, therefore, are as follows. What is a better tool to fight the pandemic? A government one or one provided by private sector? In case medical intervention is required, should it come from the government, the private sector, or should it be left to the discretion of the patient? Is such an app a public service or a commercial one? And is tracking people through maps and miscellaneous apps a bad thing? What is the scope for expansion under the Aarogya Setu app, and what are the alternatives available to this? Which one will help us fight the virus better?